Welcome back. More than 2 years after the Supreme Court overturned Roe v. Wade, data now shows that abortion rates in the United States actually went up. More than 1 million abortions were recorded in the U.S. last year, according to the Guttmacher Institute, a research group supporting abortion access. That number is the highest in a decade, and it comes despite more than a dozen states implementing bans on the procedure since the Dobbs decision. Joining me now is Aria Bendix, a health reporter for NBC News. Aria, walk us through this report. It does seem somewhat counterintuitive as more than a dozen states implemented total bans in the wake of the Dobbs decision. What is driving this uptick?
You're right. It does feel counterintuitive, Ryan. So in the immediate aftermath of the Dobbs decision, we did see abortions go down a bit. A CDC report actually came out today finding a total abortions in the U.S. fell 2% from 2021 to 2022. But then something changed last year. Since the Dobbs decision, 8 states have actually passed what we call shield laws, and those allow providers in the states where abortion is legal to actually prescribe abortion pills in states where they're banned. We also know that abortion funds and provider networks really received a large influx of donations after Dobbs, and they used those donations to open up more clinics and to help fund out-of-state travel for abortions. So those efforts combined have really allowed abortions to increase despite state-level restrictions.
And are you finding that the increase is evenly dispersed, both geographically and socioeconomically?
For the most part, yes. I mean, abortion pills are a really key part of this story, and they don't come with the same barriers as going to an in-person clinic for a procedural abortion. They're easier to find, and ordering them online means you don't have to travel to get them. You don't have to take time off work or arrange for childcare. And many telemedicine providers actually price the pills on a sliding scale, meaning you pay what you can. So it matters much less now where you live and how much money you make, at least when it comes to medication abortion.
And so this could be the next fight, right? You mentioned the influence of medication abortion and maintaining access to the practice. Earlier this year, we saw a case about mifepristone that reached the Supreme Court, but the court dismissed it, but it was based on standing, not necessarily on the merits of the case. Should we expect to see more legal challenges to abortion pill access?
We should, and in fact, we already are. So in October, the attorneys general of Idaho, Kansas, and Missouri, they filed a very similar lawsuit to the one you just mentioned in the same Texas court where that original mifepristone case was filed. And the particular judge there, who's a Trump appointee, ruled in favor of the plaintiffs last time. It's reasonable to expect he might do so again. So the question then becomes, would the FDA under Trump appeal that decision and fight for mifepristone access? Hard to say. At the same time, the Center for Reproductive Rights has filed a lawsuit in Virginia seeking to actually expand access to mifepristone even further. And those two lawsuits could potentially come into conflict with each other depending on the outcomes. So lots to watch for in the coming months, Ryan.
Yeah, especially because Trump has not said specifically that he's opposed to the abortion pill. He said that this is just a decision that should be left up to the states. So if there's federal action related to it, that will tell us a lot about where he stands. Aria Bendix, thank you so much for being here. We appreciate it.
Thanks for watching. Stay updated about breaking news and top stories on the NBC News app or follow us on social media.